Okay, my beloveds, let's talk about once again, about abnormal uterine bleeding, a common presenting complaint in various clinical settings from primary care to emergency departments of gynecology clinics, but it's not the point. Point is to clarify that questions that misunderstood by you or confuse you on the previous several years' last exams. So let's take your pens and papers and go on. So about abnormal uterine bleeding, so we have to understand that this problem affects millions, impacts quality of life significantly. This abnormal uterine bleeding is estimated to affect 30% of reproductive aged women, and prevalence increases closer to menopause. You will be asked about that. So up to 50% in some studies in menopause. Heavenly menstrual bleeding is a subset of abnormal uterine bleeding. It's the most common pattern, my beloveds. Why it's so important? So this isn't just heavy period. Abnormal uterine bleeding, particularly heavy menstrual bleeding, can lead to iron deficiency anemia. So complications are noted in your papers. So iron deficiency anemia, fatigue, limitations in daily activities, no usual activities, daily activities, work, social life, exercise, sexual dysfunction, and significant emotional distress. So recognizing the potential severity and impact on quality of life is crucial for validating patient concerns, initiating workup and treatment. Don't underestimate its impact. Now about this Palm coin classification system. This is an acronym to remember. The International Federation of Gynecology and Obstetrics, FIGO, it's acronym FIGO, developed this Palm coin system to classify abnormal uterine bleeding in non-gravid reproductive aged women. So Palm, P-A-L-M. Palm. So PALM means structural causes. Palm, it's about structural problems, issues. P matter, P for polyp, A for adenomyosis, L for leiomyoma, fibroid, M malignancy and hyperplasia. This is a Palm, structural causes. So what's COIN? COIN is about non-structural causes. C for coagulopathy, O ovulatory dysfunction, E endometrial dysfunction, I iatrogenic. That means, for example, medications in intrauterine device. Iatrogenic means caused by medical intervention. For example, medications, the intrauterine devices, and N letter, COIN, on the end, and not yet classified. Why it's so important, my beloveds? This system provides a structured evidence-based framework for diagnosis. When a patient presents with this abnormal uterine bleeding, thinking through Palm coin helps generate a comprehensive differentiated diagnosis, guiding history taking, physical examination, and an investigation, labs, imaging, so on. So, what's goal? Goal, it was away from vague or older terms like dysfunctional uterine bleeding. My opinion, very good name, dysfunctional uterine bleeding. But anyway, I'm not a gynecologist, thanks God. Anyway, okay, so Palm coin is this. So remember, and we absolutely will be asked about that. Now, so-called normal menstrual bleeding has defined parameters. Data, okay? So understanding normality is a key to identifying abnormality. So you have to remember this. Normal menstruation, according to International Federation of Gynecology and Obstetrics, this FIGO, FIGO, up to you. FIGO generally involves about frequency, normal periods, 24-38 days. Regularity of normality, cycle to cycle variation, 7-9 days. Duration, less than 8 days. Volume, now be careful. Subjectively normal, that is, when we talk about subjectively normal, the patient's perception. Or objectively, less than 80 milliliters per cycle. But how could you count it? Clinically, patient perception of heaviness impacting quality of life is more practical, of course. Go and count the volume of cycles. So, clinical importance, deviations from these parameters just mentioned define abnormal uterine bleeding. Accurately characterizing the bleeding pattern, for example, heavy menstrual bleeding, intermenstrual bleeding, and so on, irregular bleeding. Using these definitions is the first step in evaluation and helps narrow the differential. Asking specific questions about frequency, duration, volume, number of pads, tampons, clothes, flooding, and regularity is vital. Okay? Good. Yeah, flooding. So, and now about anovulatory bleeding, AUB in Palm-Cohen classification. So this anovulatory bleeding is common and hormonally driven. So ovulatory dysfunction, AUB, abnormal uterine bleeding, O in Palm-Cohen, above mentioned classification, is a frequent cause of irregular, often heavy bleeding. It results from continuous estrogen stimulation of the endometrium without the stabilizing effect of progesterone withdrawal that normally occurs after ovulation. This leads to thickened, fragile endometrium that breaks down unpredictably. Why it's so important? Recognize conditions associated with anovulation: polycystic ovary syndrome, polycystic ovary syndrome, thyroid dysfunction, hyperprolactinemia, hypothalamic dysfunction, that is stress, excessive exercise, weight changes, and perimenopause, adolescence, immaturity of the hypothalamic pituitary ovarian axis, HPO axis. Treatment often involves hormonal therapies like progestins, combined hormonal contraceptives to regulate cycles and stabilize the endometrium. Now be careful, my beloveds, a little bit tricky question, but you have to answer this question. So postmenopausal bleeding is endometrial cancer until proven otherwise. Remember like this, okay, I repeat. Postmenopausal bleeding, PMB, is endometrial cancer until proven otherwise. Any uterine bleeding occurring 12 months or more, of course, after the final menstrual period, menopause, must be considered as postmenopausal bleeding. But while often caused, of course, in vast majority of cases, often caused by benign conditions like, atrophy of polyps, approximately 10% of women with postmenopausal bleeding have endometrial cancer. Now you understand this clinical importance. We can say that postmenopausal bleeding is a major red flag symptom that requires prompt and thorough investigation, typically started with TIVUS, transvaginal ultrasound, to assess endometrial thickness, followed by endometrial sampling biopsy. If the endometrium is thickened or if bleeding persists despite a thin stripe. Never dismiss postmenopausal bleeding as insignificant. Okay? Never dismiss postmenopausal bleeding. Now that provokes panic. Adolescent abnormal uterine bleeding. So adolescent abnormal uterine bleeding is usually due to HPO axis immaturity. In the first 1-2 years after menarche, irregular cycles and abnormal bleeding are common primarily due to immaturity of this axis, hypothalamic pituitary ovarian HPO axis, leading to anovulatory cycles. This is AUBO, Palm-Cohen classification. So clinical importance of death, my beloved, to reassure a patient. While often physiological, is crucial to rule out, of course, other causes, especially coagulopathies like von Willebrand disease, little bit later, pregnancy if sexually active, infections, pelvic inflammatory disease, and endocrine disorders. Management often involves reassurance, education, iron supplementation if needed, dietary management, lifestyle management, and potential hormonal therapy for heavy or persistent bleeding impacting quality of life or causing anemia. Now von Willebrand. Consider coagulopathies, AUBC, Palm-Cohen classification, especially von Willebrand disease. An underlying bleeding disorder, coagulopathy, AUBC, Palm-Cohen classification, should be considered in patients with heavy menstrual bleeding, especially if it started at menarche or if there is a personally family history of bleeding symptoms. Easy bruising, prolonged bleeding after dental work, surgery, epistaxis, okay? Epistaxis. Von Willebrand disease is the most common inherited bleeding disorder and may present primarily as a heavy menstrual bleeding in up to 20% of women with the condition. Clinical importance of that. So, failing to consider a coagulopathy can lead to delayed diagnosis and ineffective treatment. For example, unnecessary hysterectomy. Specific screening questions about bleeding history are essential. If suspicion is high, coagulopathy studies, including von Willebrand disease panel, are indicated. Management often requires collaboration, of course, with a hematologist, definitely. About TVUS, TVUS, this means not United States, transvaginal ultrasound, is a first-line imaging for structural causes. So this transvaginal ultrasound is the primary imaging modality for evaluating, of course, for evaluating the uterus and the endometrium for when suspecting structural causes of abnormal bleeding, palm structural components, Palm-Cohen classification. So it's gold standard, of course. It's excellent for identifying leiomyomas, fibroids, assessing endometrial thickness, crucial in postmenopausal bleeding, and detecting suspected adenomyosis or large polyps. Saline infusion sonohysterography or hysteroscopy can provide better detail for intracavitary lesions like polyps or submucosal fibroids. Clinical importance of this transvaginal ultrasound helps differentiate structural from non-structural causes, guiding further management. Knowing when to order this ultrasound, for example, transvaginal ultrasound, for example, heavy menstrual bleeding, intramenstrual bleeding, postmenopausal bleeding, suspected fibroids, polyps on exam, and how to interpret basic findings, endometrial thickness, presence, locations of fibroids, is a core skill. For gynecologists, of course. Then, always rule out pregnancy in reproductive aged women. Remember that, my beloveds, always rule out pregnancy in reproductive aged women. Bleeding in early pregnancy, threatened miscarriage, incomplete miscarriage, ectopic pregnancy, gestational trophoblastic disease can mimic abnormal uterine bleeding patterns. Why it's so important? A urine or serum HCG test is mandatory if any reproductive aged women presenting with abnormal bleeding. Missing a pregnancy-related cause, especially in ectopic pregnancy, can have life-threatening consequences. This should be one of the very first steps in the workup. And about hemodynamic issue. So abnormal uterine bleeding can be a hemodynamic emergency. What does it mean? Acute abnormal uterine bleeding can be a hemodynamic emergency. Acute abnormal uterine bleeding is defined as an episode of heavy bleeding that in the clinician's opinion, requires urgent intervention to prevent further blood loss. It can sometimes lead to hemodynamic instability, hypertension, tachycardia. Clinical issue. Recognize the signs of acute severe bleeding. Initial management focuses on assessing hemodynamic stability, vital signs orthostatics, and stopping the bleeding quickly. This may involve high-dose intravenous estrogen or oral progestins combined, hormonal contraceptives, tranexamic acid, and an antifibrinolytic, and potentially urgent surgical intervention, dilatation, and curettage, and curettage, DNC, or even hysterectomy in rare, life-threatening situations and responsive to other measures. Fluid resuscitation and blood transfusion may be necessary. So understanding these facts of uterine bleeding is fundamental for provide safe, effective, and patient-centered care, and it's largely sufficient for a good answer. Now, I suppose I hope I clarified all these misunderstood questions for your big exams. God bless you. Don't forget to follow and subscribe my Dr. Y YouTube channel, as well as don't forget to subscribe my private Telegram channel, Dr. Y, the same name. How to find this private channel? You type in searching mode Dr. Y, WHY. You click start and you choose your plan. Stay blessed.